Whatever your reasons for watching this video today, I want to congratulate you, because with 1 in 12 young people in the UK self-harming, this is a taboo that we really need to talk about. DSH, or deliberate self-harm, is an umbrella term for any action, habit or behaviour that causes you harm, and this can include literally almost anything, from undereating, overeating, over-exercising, drinking, taking drugs, not sleeping, punching, cutting and burning, just to name a few. For simplicity's sake, I'm only going to talk about the last two, but if you have any concerns about something that you do causing you harm, please go see your GP, or if that's too scary, a trusted friend or a teacher. They'd rather know about it now before you cause yourself serious harm. This video comes to you in 3 parts. Part 1, preventing self-harm. Part 2, first aid for self-harm. And Part 3, aftercare. Everyone has their own reasons for wanting to hurt themselves in the first place. For some people, it's a deep need for control, to be the one person inflicting at least some of the pain that they feel on a daily basis. For others, they're so overflowing with negative emotions that they just need to let it out. And for others still, it's the only way to feel anything at all. The first step towards fully stopping your self-harm for good is to understand why you want to hurt yourself in the first place. But this is a very personal question, and it's also very difficult. So for today, I'm going to assume that you either don't know why you want to hurt yourself, or you do know and it hasn't helped one little bit. Though it doesn't seem like it at the time, self-harm is totally preventable if you've got the right tools. And tool number 1 in your self-harm prevention kit is distraction. So you feel terrible and you're sitting on the bed and you've got so much work to do, but you can't concentrate on any of it. You just need to get out of it and do something about it right now. So stop, freeze, take 3 deep breaths. You need to change your environment right now in a positive way, and that means doing something that will get you out of this situation. Get up, just drop everything. You don't even need to clean up. Just get up and leave your room and get out of your own company. Go and find someone to talk to, like the janitor or a friend or a colleague or a parent. Go to the library, go to a cafe. Sometimes being surrounded by so-called witnesses will make you think twice about causing a scene. If leaving your room right now seems like an impossible task, that's okay. Just call a friend and keep phoning until someone picks up. Talk about something non-emotionally complex, like a mutual friend or a TV show that you're both into. It doesn't matter, you just need to get out of the situation mentally. And you might just find that when you return to the scene of your almost crime, you're no longer tempted. Your second tool is something that anyone who's ever attempted an onerous task will be very familiar with: procrastination. But this time, you're going to use it in your favour. So you've committed to cutting. You're sitting on the bed, you've got the razor in your hand, but before you start, you should probably put a towel down, because when you bleed, you might ruin the sheets, and then someone will know. So you get up, you go find a towel, you come back, you sit back down on the bed. But before you cut and bleed, you might want to eat something, because you often feel faint at the sight of blood. And if you pass out and someone walks in on you, again, they're going to know. So you get up and you go find something to eat. In fact, eating something like a chocolate hobnob might actually make you feel better, but it's really important not to associate any of your procrastinatory behaviours with feeling better, because then you'll be less likely to do them in the first place. Once you've committed to causing yourself harm, you don't want to feel better. Part 2, first aid. So I want to say straight away that I am not a doctor, but I have had a lot of experience with dealing with cuts and wounds that you may not necessarily want to take to A&E, and ones that you probably should have taken to A&E but didn't in the first place. So here are my general rules about when it's appropriate to self-treat with self-inflicted cuts and burns. Cuts. So if it is visibly gaping and seems unlikely to close on its own, you need stitches. Even if you do have a suturing kit, a strong stomach and a working set of hands, I would not suggest trying to do it yourself. A professional's work will reduce the scar and also hugely the risk of infection. If it is spurting blood everywhere, you've hit something important. This can be really dangerous and you need help straight away. If you go to A&E, they'll help you control the bleeding, and they will also give you blood or IV fluids if you need it. If you can see adipose tissue, which is yellowy, or muscle tissue, which is orangey brown, you've cut all the way through the epidermal layers on the outside, and this can be really dangerous. If you cut all the way through the skin, you increase the risk of infection, because the bacteria can get straight into your blood. And septicemia, which is blood poisoning, is really horrible and unpleasant, and I really wouldn't suggest risking that. So go to A&E, get them to clean it out properly, and get stitches. Finally, if your cut is in an awkward position like the arch of your foot or your elbow or your knee, again you need stitches. If the wound keeps opening and closing again and again, scar tissue builds up and you end up with this big thick scar which is kind of red, which is called keloid scarring, and not, apart from being really ugly, is kind of uncomfortable. If you get them to put stitches in, then this will be reduced. Burns. Serious burns can be a lot harder to treat than equally scary looking cuts, so it's really important that you go to A&E if any of the following apply to you. If it doesn't hurt, you've burned all the way through to the nerves and you need help straight away, or you could lose sensation in the area forever. If it covers more than 5% of your body area, that is about the size of one of your hands, you risk serious dehydration. The reason for this is when cells get burned, they start to lose tissue fluid at an uncontrollable rate and you just lose water from your body. So you need help and you'll go to hospital and they will give you IV fluids which will combat this. Finally, if the burn is on your face or genitals, regardless of the size or severity, you should go to the hospital. The reason for this is unsightly scarring, and also they are both high blood areas, and once again with the loss of tissue fluid you need IV fluids. If any of the previous guidelines apply to you, stop watching right now and go to A&E. Really go. The rest of this video doesn't apply to you, okay? Right, so the rest of you have small or superficial burns or cuts. Let's deal with cuts first. Using something non-fibrous and clean, preferably sterile gauze, apply firm pressure to your wound and wait till it stops bleeding. This should take anywhere between 30 seconds and a couple of minutes, depending on the depth of the wound and the blood pressure of the person. When it stopped bleeding, have a look at it. If you can see yellowy adipose tissue or orangey brown muscle tissue, stop and go to A&E because you've cut all the way through the epidermis and you need stitches and you can't deal with that yourself. If it's just kind of gaping a bit, you need steri strips. These are great. You can buy them in any pharmacist, and if you are a regular self-harmer, you should probably have a set in your first aid kit. So take out the strip and cut it in half so that your strip is about half the size. And then remove the small piece of paper from the end so the ends are protruding. Now you need to wash your wound really thoroughly. So using something like saline solution, otherwise known as contact lens solution, or first aid wash, give it a thorough, really good, intense washing. And pat dry. I'm not going to do it because I've drawn it on with marker pen and it'll just wash off. So pat dry. And then let it air dry the last little bit so that you don't disturb it too much. When it's nice and dry and you've got all the rest of your kit ready, give your hands a good washing. Use something like alcohol hand gel, or if you have the guts to leave your room at this point, go and use soap and water, it's just as good. Giving my hands a nice washing. Right, I'm good to go. My wound is clean, it is dry, and my steri strips are ready. Starting at one end of the wound and then the other, apply half the strip to your wound and peel it off. Now pull on the other end so that the wound is drawn closed and press it down on the other side. Don't actually press in the middle because you'll just infect it. Do the same on the other side. Note how I am using steri strips from opposite ends of the strip. This is so that I don't introduce infection. I'm going to do the rest non-sterilely just because it's quicker, and I'm demonstrating here. So once again, start at one end and then the other, drawing the wound together until it is nice and closed. Right, my wound's looking pretty good. It's all closed up and it has stopped bleeding. Now I need to dress it. If, like my wound, it's pretty big, you need a dressing that is bigger than this. You need a dressing that will cover the pad, not the sticky bit, will cover the whole wound. This dressing is too small because the pad is actually only this big. and the sticky bit will go onto the steri strips. And if for any reason you need to remove the pad to have a look at it, or say you have a shower and it gets wet and you need to replace it, you'll remove the steri strips at the same time, which will interfere with the healing process. In this case, this one, although it seems like a bit of overkill, is actually the appropriate size. Apply the dressing and keep it clean, closed and covered for as long as you can until it starts to scab over and it looks like it's closing. Then you can use warm water to gently remove the steri strips and try and leave the scab as in place as possible. Once you've removed the steri strips and it looks like it's closing, expose the scab to air because it will keep it hard and make it heal faster. That's how you deal with cuts. Now let's go for burns. For burns, a similar process applies. The first thing you want to do is have a look at it. Is it bigger than one of your hands? Does it not hurt? And is it on your face or genitals? If it's not, then you're pretty good to go. First thing you want to do is put it under cold, not really cold, but kind of lukewarm to cold water for at least 10 minutes. This takes all the heat out of the wound and stops it getting worse. After you've done that, you need to sterilely wash it. So once again, using saline solution or wound wash, give it a good, really thorough washing and pat it dry. Let it air dry for the last little bit, as I said before. Now, once again, you need to dress it. Once again, with my burn, it's a little bit marginal this time because there's no steri strips, but the whole overall size of the burn is bigger than the size of the pad. See? It's pretty marginal, but it's just a little bit too on the small side. You want the whole pad and only the pad to be covering your burn. Once you've dressed it, try and keep it as covered for as long as possible and as clean, dry and closed for as long as possible. Burns are kind of quite scary sometimes and you need to just keep it clean or infection could happen quite easily. So that's how you deal with burns. In the next part, we're going to talk about aftercare. Whether you've been patched up by a professional or decided to self-treat, it's going to take more than a few stitches, steri strips and an adhesive dressing to fix that. And aftercare starts from day one. The truth is, if you have cut or burned yourself with intention, you're probably going to have a scar for the rest of your life. The reason for this is when you sustain an injury like that accidentally, your nervous system kicks in and pulls you away from the source of the pain. But during self-harm, you're overriding that reflex, so you can't really limit the damage. And the result can be anything from a vibrant line to a really horrible keloid scar that's bigger than the original wound. During the time it takes the physical wound to heal, remember the 3 C's and keep it clean, closed and covered until it scabs over. It also goes without saying, but don't go swimming if you've had stitches because this hugely increases the risk of infection, being in a pool full of other people's germs. You should also try to limit movement to the area, especially if it's in an awkward position like the arch of your foot, knee or elbow. Because if it keeps reopening and closing, this also makes the risk of infection a lot higher. You should keep an eye on the wound to check for infection. So if it starts to feel hot and sore, take the dressing off and have a look at it. If it's just kind of hot and sore and a bit swollen, it'll probably sort itself out, but that's all right. But if it is oozing pus or especially radiating red lines out from the site of the wound into the surrounding skin, you really need to see a doctor because it sounds like you've got a bit of an infection that needs antibiotics. If left untreated, this could lead to septicemia. Living in the UK, your best option is NHS 24. The number for that I think is 112, and they can organise an appointment for you in a walk-in centre and you could have antibiotics in a matter of hours. If it is just kind of hot and not radiating red lines, maybe oozing a bit of pus and it doesn't seem that serious, just organise an appointment with your GP and go and talk to them about it. You don't have to tell them how you sustained the wound, but I would suggest it because if you've got to this stage where you need actual medical intervention from your self-harming, it sounds like this is something you need to confront, and GPs can be incredibly helpful. There's all kinds of organisations out there that can help you. But if that's not your thing and you want to try and get through this by yourself or you're not ready to talk about it yet, you don't have to tell them, just tell them something else. Following an incident of self-harm, you've got more than physical healing to do. You're probably going to feel better immediately afterwards, but pretty soon the shame and disappointment in the whole situation is going to creep back in, and you might end up feeling worse than you did before you cut. Just remember, please be kind to yourself regarding the whole situation. Just treat yourself with the same kind of compassion you would a friend or just anyone that had made a mistake. You'd forgive them eventually, wouldn't you? Because they're your friend. Also, if you're ever on the helping side of self-harming, please remember, never make a self-harmer promise not to do it again. This adds a whole other level of angst for the harmer, because if they do crack and end up self-harming again, they've got a whole layer of disappointment in not only hurting themselves, but disappointing you and breaking a promise. It might also stop them from asking for help, which can be dangerous. You wouldn't ask someone with a broken leg to run a marathon, so don't ask a self-harmer to not harm. Scarring and its everyday challenges has a far more long-lasting effect than the original wound, so if you do partake in self-harm, you better be aware of this. The smart self-harmer thinks ahead and wounds themselves in places that it's easy to cover up. While this seems actively dishonest, it can actually be very helpful for the person, because not having to hide and answer questions all the time takes the pressure off and might help you work through some of the causes by yourself if that's what works for you. If your scars are in more visible places, then long sleeves and trousers are a solution in the winter. But if in summer, when the mere thought of a jumper is making you sweat, a wristful of bracelets or a designer lace hand warmer are just as effective, plus they are kind of cool as well. I'm yet to find an affordable and effective makeup solution, but I have found that a green stick concealer topped by a powder foundation stands up under cursory inspection. Sports, especially swimming, are harder because you're generally scantily clad and any makeup just washes or sweats off, but men's running shorts will cover you to the knees, and you can buy something called a leg suit from simplyswim.com for under 40 quid, which will cover you to the knees. This is basically just a normal swimsuit with bicycle shorts attached. When it comes to ongoing treatment, like fading of your scars, I have found two things that work. The first is Penumbra gel, which does work, although you need to apply it very regularly, and it also dries and looks kind of flaky, like you've got bad sunburn, so it's not particularly pleasant. It's aloe vera based, I think. The second one is good old-fashioned bio oil. This is my absolute favorite. It really genuinely works. It softens up your skin, and it smells nice. It sinks right in, so it's non-oily, and it doesn't look flaky like you've got bad sunburn either. The most essential thing is to have an excuse on the tip of your tongue that you can just reel out when people ask you questions. I have several, from the pretty mundane "I was in a car crash" to the kind of absurd and unbelievable "I was in a fight with a bear." You should have seen the bear. Let them decide what they're willing to believe about you, and if they push you and say they don't believe you, then tell them to bugger off, because it's none of their business. Thus concludes my video about the treatments of self-harm. If you have any questions, feel free to PM me. I'll do my best to answer them. Or if divulging your deepest, darkest secrets to strangers on the internet isn't exactly your thing, then try to talk to someone you know and trust. You'd be surprised where answers can come from. Otherwise, I've put a list of websites down below that you might find useful if you have the time, have a gander. I hope you found this video generally informative and useful, and I wish you the best of luck with this problem. Like I said, it's a taboo that we really need to talk about. Don't forget to be awesome. Bye.